Hi, I'm Dr. Shruti Tannan. I'm a plastic surgeon, and I want to talk about one of the most important things, the plastic surgery consult, and what you can expect. I think a lot of people have some apprehension, a little bit of fear, anxiety, just in coming to that consultation. And I want to make sure you know what you can expect. Number one, you should make sure that your consultation is with a board-certified plastic surgeon and not an assistant, a medical assistant, a nurse at the practice. Now, these are people who are amazing support staff in my practice. They're just not the person doing the consultation. The consultation, where you get a medical opinion, where you get a medical exam, should be by a medical doctor, an MD. So just number one, make sure, because that's my caveat. This is about a consultation with a board-certified plastic surgeon. What can you expect? So one of the first things you can expect is they're going to want to know your history. That's relevant. I need to know what medications you take, what medical conditions you have, because some of those can change how you might heal from surgery, how you might recover from surgery, and we might want to talk to some of your doctors. So that's really important to make sure that we know what's going on with your body and your health. Second, they're going to want to know what are the things that you're expected to do in your life and in your family. Are you taking care of elder parents or grandparents? Are you taking care of small children? Does your work involve manual labor, heavy lifting? Are you a nurse in the ER who has to be able to do CPR at any given moment? All these things determine your recovery time, how much time you need to take off from work. These are things that we want to plan out so we can help you prepare. And all that happens during the consultation. It's the beginning conversation. It's not the first and final conversation, but it helps you visualize, okay, is this the right surgery for me? Is this the right surgeon for me? Is this the right time in my life to have this done? Or should I wait? Should I wait until we have that nursing aide hired to live in with my loved ones so that I can focus on my recovery rather than trying to take care of this person and focus on my recovery? We want to set you up for success. And finally, yes, we're going to examine you. If we're talking about breast augmentation, we're going to try implants on, and we're going to make sure you feel like the weight isn't too much. We're going to look at pictures, of course, in the gallery, but we're also going to try on for size and see. When you look in the mirror and when you look down, you'll get a sense of, okay, this is me. This is how I was meant to be. Or if we're talking about a breast reduction, we'll look in the mirror together and I'll show you what I anticipate removing. That's what I'm hearing you say. Is that something that would make you happy, or do you think like you want more off, less off? But you don't know until you try, until you meet with someone. And I've noticed that some patients, when they come in, are so tightly wound because they're nervous, they're worried. There's so many things that can lead to feeling shame, and not to mention just self-conscious because you're totally exposed, very vulnerable, literally. So it's important that you choose your surgeon wisely. Ways you can tell are by asking friends, looking at reviews, getting to know the surgeon on their website, their videos, really getting a sense of, is this someone I can connect with? Is this someone I can trust with things that you probably don't even tell your loved ones, your partner, your parents? Like this is serious, this is real, and you need someone who's authentic and who's going to be able to connect with you and meet you there so that you can feel comfortable when you're most vulnerable, because you're going to trust this person to take care of you when you're asleep. And I think that's a really important thing to understand about your relationship with your doctor. You don't just have to go to anybody just because they're 5 minutes from your house or just because that's who did your friend's breasts. You need to find the person who's right for you. If you have any questions, feel free to drop a line in the comments and follow us for more tips.